Hello, this is Dr. Drew Hall here with Upper Cervical Healthcare of Los Angeles and Carson. What I want to talk today about is a very common musculoskeletal condition and complaint that, probably a quarter, probably half of the population at some point in their life will experience. Now, there's a difference between having it once in a while and all the time. A lot of people suffer with chronic pain between their shoulders. A lot of times it's on one side. A lot of patients that come in, they talk about how they have pain between the shoulder blades, or they have a knife stuck between the shoulder blade and the spine. Now, just to get into some neurology and how the musculoskeletal system is controlled by the neurology, there is something called the spinal accessory nerve. It's a cranial nerve, and it basically branches off the first, second, third, and fourth cervical nerve root. So on each side of the upper neck, each vertebra, and this goes through the whole spine actually, on each side of a vertebra there's a nerve that comes out of each side called the spinal nerve. The spinal accessory nerve branches off of the top four nerves, and it runs down the neck, and it runs right down to the shoulder blade area, and it controls the trapezius muscle. So one of the muscles that's involved when someone feels like they have a knife jammed in their shoulder blade is that muscle is an acute spasm and it's not releasing, and that's where the pain is coming from. Now there's other people who feel the pain dead center, right in between the shoulder blades, and that can be a number of different muscle groups. Now both of these problems that I've described are usually coming from biomechanical disruptions in the spine, which were started from injury to the joints, especially in the neck, because that's where that spinal accessory nerve is located. But let me just draw out a very quick scenario. One of the things that happens when someone has a car accident, when they have had taken a soccer ball to the head, when they've had a concussion from sports, when they've had a T-bone injury, when they've dove off their diving board and landed their head on the bottom of the pool, those types of injuries can cause the upper cervical spine to lock out of position. Now, what controls posture in the body, actually the postural muscle tone in the body, is controlled in the brainstem, which is housed by C1 and C2. So these two little bones house the brainstem, and the brainstem is responsible for among other things, postural muscle tone control. So when you have an injury to the upper neck, the most common thing that occurs is what we call anterior head bearing. So you should have a C-shaped curve in your neck. When the upper neck gets locked, the head moves forward, right? Now the head's 10 to 12 pounds. So every 3/8 of an inch, the head moves forward off of its axis. It actually doubles the weight of the head on the upper back and mid-thoracic musculature, because it's got to hold it upright against gravity. It's no longer centered over the shoulders, and inherently what that does is the mid-thoracic muscles go into spasm because they're doing the best that they can to adapt to the situation. But one of the end results of that is what we're talking about here today, is pain between the shoulder blades. Now, if it's dead center, that's like a bilateral contraction of those muscles. A lot of people that feel the knife in one side, that means that one side of the trapezius muscles in spasm and not the other. And that can be coming from, again, from the upper cervical spine being misaligned, and it's influencing that spinal accessory nerve. Now, if it's chronic, meaning it's been there for months on end, what's happening is it's due to the postural adaptation. If you had this happen, every now and again, usually what it means is you have a joint locked in the neck, and from sleeping funny or whatever, and then it kind of adapts and corrects itself, and so that knife feeling goes away. Now, that misalignment, even though it may correct a little bit and your body adapts to some extent, and that pain is coming once every 6 months, it's still a good idea to get your upper cervical spine checked so you can get it back in its normal biomechanical range, so you can function the way you're supposed to. So I always tell patients that come in with neck pain or mid-thoracic pain that it may be a blessing in disguise, because if your upper cervical spine, this atlas, is locked out of position, it's not just affecting the muscles, it's affecting all the neurology in your body. And your brainstem, which sits here at the base of the skull, controls heart function, respiratory control, heart lung function, blood pressure control, muscle tone regulation, basically all the function in your body that you don't think about that's happening every minute that you're awake or asleep. All the function in your body is all controlled in the brainstem. So if you are suffering from mid-thoracic pain, that stabbing muscle pain between your shoulder blade, and you're looking for a way out that is beyond just swallowing pain-killing medication, we do offer a free consultation in our office. We have 2 offices. One's in Los Angeles, and that phone number is 213-399-7772. And our Carson office is 310-324-6172. You can give us a ring. Again, we offer a free consult exam. You can come in, we'll run you through a battery of tests, give you a little deeper explanation about what it is that we do, tell you about what we found on your tests and whether we can help you or not. So hope this video was informative, and hope to see some of you soon.